Hello and welcome to Advice in Action, the conference from the Advice in Southampton partnership. This session is looking at carers issues and the support that's available for carers in the city. Our speakers today are Jo Jennis, Senior Coordinator at Carers in Southampton, and Lynn House, who's a benefits caseworker and supervisor at Citizens Advice Southampton. You'll learn, first of all, who is defined as an unpaid carer and the types of people that tend to be carers. And we'll also explore how you can spot carers even when they don't think of themselves as such, which is remarkably common. We'll explore some of the issues carers can face and how, with support, these can be addressed. And you'll get a really good overview of the support that's available locally. Finally, we'll briefly discuss your role in identifying carers and helping them to access support. I'm now pleased to hand you over to Jo from Carers in Southampton.
Thank you, Sarah, and hello everybody. My name is Jo Jennis and I'm the Senior Coordinator at Carers in Southampton. We're a free service for adults providing unpaid care to someone with ill health or a disability, and we're a charitable project commissioned by Southampton City Council via local charity Southampton MenCap. I'd like to begin with some definitions of an unpaid carer. I've got these definitions from NHS England. Now, quite often when people think of carers, they think of agency workers, people coming in from care organisations to provide personal care and support. A carer is anyone who looks after a family member or a friend who needs help because of their illness. And these roles and responsibilities can vary wildly. They can range from everyday tasks such as getting out of bed and helping with personal care to things like household administration, making sure people have their supermarket food in, getting prescriptions from the doctors, or managing bills and other appointments. Often we find that many carers don't see themselves as carers, and it takes an average of 2 years for them to acknowledge themselves as such. Many just continue to see themselves as a husband or a wife, doing till death do us part and providing that support and care, as diligent sons and daughters helping out their parents, as good neighbours helping, and indeed they are. But they also can acknowledge themselves as a carer and have support available to them. So now I'd like to look at some carer demographics from across the UK. More than half of family carers tend to be women, and that's a similar picture to what we see in Southampton. Half of them are aged between 40 to 64, and a quarter of carers are 65 plus. People who are carers tend to be working in routine occupation. A lot of those working in management and professional occupations actually make up the largest occupational group of carers. Carers are less likely to be in paid work and more likely to be in part-time compared with non-carers. That's due to the increase and stresses of their caring role. Carers tend to have lower qualifications than non-carers. However, a third of carers aged 40 to 44 do have a degree or a higher education equivalent. And almost just over half, provide care to someone they live with. And the other half are providing around 20 hours a week of care. So here we've got some conditions that require support. It's not an extensive list, but there are quite a few things that will come up quite regularly. Cancer, sadly, dementia, Parkinson's. There might be a lot of carers out there who are supporting someone with a learning need, or perhaps supporting a parent who's become elderly and frail. We'd also expect to see in the future, as a result of the pandemic, COVID-related illnesses being a cause for people to be carers. So we have a table here from the Social Market Foundation with some statistics about carers. 67% are caring for an older relative, 23% are caring for a partner or spouse, and 11% are caring for a sick or disabled child. There are the so-called sandwich carers, family carers who also have dependent children. Their analysis shows that almost a quarter of those who provide family care also have children under the age of 16. That 67% statistic as well is likely to rise as we have a rising population and people are living for longer. So let's look at the extent of unpaid caring in the United Kingdom. Around 1 in 8, that's about 6.5 million people are carers. That's about 10% of the population of the United Kingdom, which is around 65 million. Every day, 6,000 people take on a caring responsibility. That equates to over 2 million a year. Again, as we saw before, over half of the carers are women and 42% are men. And at 3 in 5 people will be carers at some point in their life. There are also 1.4 million people who are providing over 50 hours a week of unpaid care. Some further statistics: 132 billion is saved to the NHS and the economy by voluntary care. And you put that in stark comparison to 30% of carers will have an annual loss of income of around £20,000 over their lifetime. 5 million people in the UK are juggling caring responsibilities with work. That's 1 in 7 of the workforce, a huge number. And for our young carers, 800,000 are out there aged between 5 and 17 years of age. Let's move on to the local picture, unpaid caring in Southampton. Southampton has an estimate of around 32,000 residents providing unpaid care to a family member or friend. Carers in Southampton know of about 2,500 carers. Of those carers, we know that 60% are aged 36 to 65, 23% are aged over 65, 19% are caring for more than one person, and sadly, 94% of those have had health problems due to their caring role. The Joint Strategic Needs Assessment population stats for chronic condition in Southampton predicts that 40 to 44 people have one chronic health condition. By the age of 65 to 69, over a third will have at least 3 conditions. And by 85 to 89, almost a third will have 6 chronic conditions. Carers' health really suffers from their caring role, and we know that carers have poorer health outcomes than non-carers. Got some more statistics here from NHS England. We've covered some of these so far. An ageing population with higher life expectancy, the sandwich carers, and the caring responsibility having an adverse impact on mental and physical health. But I'd like to bring your attention to this statistic at the bottom. 70% of carers come into contact with health professionals, yet health professionals only identify 1 in 10 carers, with GPs more specifically only identifying 7%. So quite often we as professionals come into contact with carers and we don't realise that they are such. Often that's because those carers don't identify themselves as carers, and it's up to us to raise that awareness, to empower other professionals and empower carers to see themselves as such and recognise this fact, and that they can access help and support to help them in their caring role. So just some further comments about caring. There's a huge impact on family relationships and personal time. Many carers say that their caring responsibilities made employment impossible, and they're missing out on social life employment opportunities. Many parent carers say that they can't access childcare for their disabled children, thus adding huge amounts of stress and pressure to their caring role. The demands are relentless, causing a huge impact on mental health, and tiredness, stress, depression, anxiety are words that dominate carer comments. Those providing high levels of care are twice as likely to be permanently sick or disabled themselves. And 72% of carers responding to the Carers UK State of Caring 2018 survey said they had suffered mental ill health as a result of caring. That last statistic, 8 out of 10 people caring for loved ones have said they felt lonely or socially isolated. And I'm sure this has only risen due to the trouble we've had with the pandemic of 2020. So what are we here for? Care identification, rights and recognition. So when carers are recognised, a minority reach that slow realisation that they were a carer due to what they were providing. Quite often carers will tell you everything they're doing, but not actually use that word carer. They are looking after mum, they're looking after dad, they're doing the laundry, they're providing emotional care, they're picking up the bills and picking up the medicines, they're making sure the house is clean, and they're helping their parents get out of bed, but they won't use that word carer to describe themselves. Sadly, children's social care and care homes scored poorly on recognising the role of a carer, and that's understandable. You know, quite often people are coming in and supporting the service user who's using that service, and they might not have the time to actually stop and have a chat to them to recognise them as a carer and that there are help available to them. Sadly, carers often miss out on doing things like emergency planning, which is vital if their carer has an accident or they're unable to provide care. Carers will always put off their own appointments, whether it be for the doctor or health appointments. They'll put off doing important things that could really help in the long run because they simply are so time poor and don't have the time to support someone to provide that information. We've got a couple of comments here that carers have provided to us. I won't read each, but you know, you can see each comment and what they're saying. You know, the anonymous comment number one, this person feels unemployable and have suffered financial problems because of their caring role. The second finds it difficult to maintain relationships. They have no social life of their own, and their caring role is putting a real strain by doing all these different roles as breadwinner, parent, carer and wife. The third, it just sounds exhausting, 16 hours a day long, busy from the moment they get up before the sun's risen, and the weekends there's no let up for it. Person number four had a really poor experience in hospital where they came across a consultant who really didn't understand their caring role and the pressures that put upon them. And the fifth person, as we can see, has just had no rest from their caring role. They can't get any time to go away to even enjoy a holiday, something that many of us take for granted. So what do carers want? Well, like anything, they want to be respected and recognised for the care they provide to that cared for person. Carers are experts in their own lives. They know so much about the care and what the cared for person needs, and they want to be involved in their treatment and make sure that they are recognised as that expert in their care. They want to ensure that information is shared with professionals and themselves so that they know what care is being provided to their care for person so that they can have an input into that support and care. They want to know clearly what information is available to them and help professionals to link up so that there is a circle around the person. They want flexible care so they're able to live life to the fullest for themselves and the person they care for. They want to recognise the contributions of the whole family around them who are supporting and providing that care. But most importantly, they want to be treated with dignity and compassion by those professionals they come into contact with. Those comments came from the NHS Commitment to Carers engagement process. So that leads us nicely to our service, Carers in Southampton. Carers in Southampton is a free service to people providing care and support to anyone who is a cared for person living within the Southampton city boundary. So that means that, you know, a carer could live outside the city, but if the cared for lives within the city, they would be eligible for our service. What do we offer? We offer support workers who offer information, service navigation and referrals to other organisations across the city. We have a fantastic website which is full of information about services, community organisations, videos of speakers. We also send out regular emails and newsletters about relevant information for carers. We hope to start our monthly carers lunches again soon. We used to provide these with a speaker and the opportunity for carers to meet one another, and we would often get a lot of brilliant feedback about the peer-to-peer support that the carers received, getting to talk to someone who really understands what it's like to be a carer. We also provide carers cards, which give a carer a form of identity to show that they are recognised by their local carers organisation, and it is also access to discounts across some stores and cafes and places across the city. As mentioned earlier, we've helped provide emergency plans where carers can put an emergency plan together, which they can either store with Southampton City Council, or if they wish to, they can just keep a copy for themselves and distribute amongst their friends and family, so that if they are in an emergency and unable to provide their care, the information is there safely to make sure their cared for person has their care continued coherently, simply, without any problems. Finally, as mentioned, we have two fantastic carers assessors who provide carers assessments which evaluate the eligibility for carers for services around the city, whether they be community organisations, the NHS, or perhaps support from adult social care. Southampton City Council carers assessments provide a personal budget, and what that means is that a carer can use that to purchase something that will benefit their well-being. It's not means tested, so it's not against any benefits they might be in receipt of. Many carers also get a bit confused between this and carers allowance, which Lynn is going to talk to about after this presentation. I don't want to focus too much on what we don't provide, but sadly we don't provide respite or paid care to go into the home. We're unable to do home visits or provide form filling or crisis intervention, but we can support and signpost you to services that do provide these services. So our support is delivered via telephone unless there is an exceptional need. We're not available for appointments or drop-ins at this time, and we can now provide Skype, Zoom or Teams meetings for people if needed. If you do have an additional communication need, face-to-face meetings can be arranged by advance and in a COVID secure environment. If you need an interpreter or language support, we can request to get this help for you as well. Engagements events are held nearby, and attendance is strictly by advance bookings. We do like people to book in before they come along. Some carers might not want to register for our service, and that's absolutely fine. It's totally, the decision that's up to them. And if they don't want to, we do have a fantastic website which has so much information. It's quite incredible. We're hoping that around over 100,000 people will view it in 2021. On our website, you can find referrals for professionals. There is a referral page where you can make a referral for a carer. There is a self-referral function as well that carers can use to self-refer. We have a search tool that can find support groups and drop in advice. That's postcode dependent and care condition dependent. So a carer can put in their postcode and their care condition of the person they care for, and they can find relevant groups and services that can help them. We have a directory of statutory and voluntary organisations that are offering support, and we regularly put up news on regulatory changes, benefits, consultations, services, things like that. We also put up events that partner organisations are doing on an events listing, and we have a booking system so that carers can easily book onto events that we hold. The Young Carers Project is provided by our friends down at No Limits, and we work closely with them to provide this service to the young carers living in the city. Young carers provide family assessments, a young carers assessment that looks at the specific need of a young person, and they do also deliver regular groups to young people, providing knowledge, skills, respite, fun and soft outcome sessions. They do tailored workshops as well to help support the young carers, and they provide one-to-one support for young carers with high levels in needs in terms of their caring role. They also match young carers with volunteer befrienders to provide positive relationships and build self-esteem. And they provide those young carers with fantastic activities and access opportunities they might not otherwise been able to take part in. Just one last point, I'd just like to touch on the recent carers scrutiny inquiry that Southampton City Council undertook, and we worked with them on this. Some of the key priorities that arose was about identifying more carers across the city, part of the reason why I'm doing this presentation today, promoting the identification and support for civil service and NHS employee carers and helping them, to work closely with primary care to promote the adoption of the GP care equality marker, to improve support for parent carers. Carers in Southampton make all the elements of our service available to parent carers with the exception of carers assessments. These can be accessed from the local authority. We also promote, they also look to promote the Young Carers programme in schools and help to identify young carers, and also establish a young carers identification card, much like our own carers card ID. Finally, I just want to leave you with some lovely carer comments that we've had about our service, and I think my favourite is the comment in the middle. The friendly, compassionate and empathetic nature of the people who took the time and trouble to discuss my situation with me. Also, the guidance I received about support for me as an unpaid carer. There were many things I was not already aware of. I'm not going to sit here and say that, you know, registering with our service is going to make everything better for a carer, but hopefully we can help to support and empower those fantastic individuals doing a brilliant job supporting a cared for person living in Southampton. There's a lot of great work that's going on in the city and a lot of great organisations who just want to help their community, and at Carers in Southampton we hope to help our carers signpost and find out about what's going on and provide them with relevant and engaging support to help them do their caring role. Thank you very much.
Thank you, Joe. I'm Lynn House. I'm a benefits advisor at Citizens Advice Southampton. As Joe's already mentioned, carers often suffer financial hardship due to their caring role, and not always aware that there are benefits they can claim to reduce that hardship. The first benefit is carers allowance, which is payable at £67.60 a week. It's not based on income or capital or your partners, so it's not a means tested benefit. So that is quite, that would be good if you're not on a means tested benefit. It also, you can also work, but not earn more than £128 a week after tax and deductions. You can also be in receipt of occupational pension, which wouldn't affect the payments. It's not classed as earnings. There are, with any benefits, there's always eligibility criteria. This is something we can help with, going through the eligibility. The other benefit for carers, if you're receiving income-based benefits as universal credit, is there is a carer's premium element that's paid £163.73 per calendar month. As with carer's allowance, you must be providing care for one person for 35 hours a week, and they must be in receipt of a disability benefit. That's middle rate or high rate disability living allowance, standard rate or high rate PIP, attendance allowance or attendance allowance to qualify as a carer. You must also be resident in the UK and not be subject to immigration control. At Citizens Advice Southampton, we can check that you meet all the requirements, and we can assist you to make applications. We will also check the qualifying benefits of the person you're caring for. If they're claiming employment support allowance, they may well be in receipt of severe disability premium, which is an extra benefit that's paid if they're receiving PIP as well and don't have anybody providing care for them. If a carer does claim carer's allowance, then the person they're caring for will lose the severe disability premium, so they will be worse off. Again, we will do a full check with the person yourself and the person you're caring for to make sure that there isn't financial hardship. If you move out of your property to live with the person you're caring for, and there is only you and yourself in that property, then you will be eligible for council tax reduction for a 25% discount, as that property will be classed as just one occupant, which would be the person you're caring for. So the carer will get 25% discount. We also have a caseworker who specialises in residential care and also can give advice on understanding mental capacity, power of attorney, court protection, and how appointeeship works. She can also check that decisions that are given for people going into care are correct, as in the finance, how much they have to pay. You can also check their contributions are okay. Sometimes carers do have an issue when they're in employment. Employers might not allow time off. Again, this is something we can help with to challenge. And also, quite often carers might end up with health problems themselves as a result of caring. We can again advise on benefits for them and also advise on any employment issues they might face. At the moment, our advice, because of the pandemic, is mainly telephone advice. We can see people face to face if it's necessary in COVID secure conditions. We're also looking to reinstate home visits, again, only if absolutely necessary, if somebody is housebound. And again, it will be with COVID checks made before a visit is made.
Thank you, Lynn, and we'll be sharing the contact details for Citizens Advice Southampton in just a moment. On behalf of all of our speakers today, thank you very much for listening in, and we hope you found this session useful. If you have any specific questions about this presentation, you can email them to conference@adviceinsouthampton.org.uk, or you can get in touch via our website. Finally, I'll leave you with the contact details of Carers in Southampton and Citizens Advice Southampton.